Doc, thank you so much for your time this morning. Let's just talk a little bit about what the stats are saying to us. I was looking at the NICD report regarding the year's reflection of the number of hospitalizations. They were sitting at about 460,000 or so and 96,000 deaths subsequently in hospital. But when we're looking at the trajectory now of admissions, are you satisfied that indeed we can breathe a sigh of relief as the country, given the number of people that are actually getting into hospital as a result of COVID-19?
Indeed, we have seen that currently the statistics are seemingly giving us a little bit of confidence compared to the previous waves that we have seen, except for the Western Cape. There are more infections indeed, but there are less hospital admissions and there are less deaths. So we are making predictions that are actually giving us hope as a nation around the COVID-19 epidemic.
Yeah. To what do we attribute these low hospital admissions to? Is it to the variant that is less severe? Is it to the capacity of hospitals, or is it to the people that are actually adhering to regulations that are now seeing us on the other side of this wave?
Yeah, so in epidemiology, you attribute such a picture to various things. One, many more people have been vaccinated compared to the other waves, so that actually is working in our favor. The second thing is that we believe, as we are predicting and doing predictive modeling of this virus, like we did in the Spanish flu, we are seeing that this could be a less virulent strain compared to the previous strains, like the Delta strain, for example. And then the third thing, I don't know whether people are adhering more than they were in the previous waves, but obviously the tools that we have in our arsenal, like the vaccinations and definitely the strain, which seemingly is less virulent, is working to our favor at this moment in time.
And based on the predictions themselves, can we expect more variants of this virus to arise in the not-so-distant future? And how are we able to tell that, one variant is severe to another, that we should brace ourselves for one variant and then we should perhaps relieve or breathe a sigh of relief for the next variant, which may not be as severe? How do we know what's to come?
So we look at the pathogenicity of this particular variant, and we know that is causing less severe infections compared to the previous one. But the challenge that we have is that we may not necessarily predict, because we have seen in developed countries that even though they were having this Omicron strain, some of them are having rising hospital admissions. So that actually we may not be too confident. But the predictions are based on what we saw, for example, from the Spanish flu, that the variants that were there previously actually would become less and less virulent. Even though the number of infections go up, the number of hospital admissions and death actually does go down. We don't know whether we're going to have other variants. Perhaps we will, because viruses, they do mutate for a living. So we will actually get more variants perhaps, but at least we are hoping that this is the beginning of the end.
Then how far are we, Samukeliso, in terms of realizing the COVID-19 virus as not perhaps being a virus where we all need to be standing in absolute attention to, where we can look at it, I don't know if it's possible, but where we can look at it as a common cold, for example, where we're living with it, that it becomes almost as if it's daily life?
Yes, we are. That's the hope, right? That's the hope that you and I have around this virus. And indeed, actually, even the Omicron variant, if people are vaccinated, we believe that it actually would become more or less like the common cold, but we don't know how far. So we are working tirelessly and collaborating across the globe. Many papers are being churned out to look at whether this is a virulent strain. We don't know whether we are at the beginning of the end, but it is our hope, because all our predictive models, they are based on what we saw in previous waves, in previous epidemics, to see whether the current virus actually is becoming more or less like a common cold. But the answer is we may not know, may not be confident, but we are hoping that the signs are there that this is indeed the beginning of the end. But time will tell, and perhaps after the festive break, we would know more about this particular strain.
And it sounds as though we are learning how to adjust to the realities of COVID-19 being amongst us. And if we go by the hospital admissions, them being low, just says that no matter how much we can adjust, it looks as though society is just continuing. And based on those findings then, in your assessment, do we need regulations any further?
Indeed, we do, because there are many variables that we still don't know. We are not confident that we are at the end. We are not confident about that. So we do need some regulations, at least to curb the spread of the infection, number one. And we know that we still have people who are admitted in hospital. We still have a high death rate for this. So we are not out of the word pandemic or epidemic as yet. So we need those regulations. You remove regulations based on science. So, for example, when the government promulgated that perhaps quarantining people and doing contact tracing is futile, that is based on evidence, that is based on practice. So we will be revising regulations as we go ahead based on what we are seeing while in the labs and in terms of the trends of the virus in terms of admissions and in terms of the death rate. So for now, I think we should all stay safe. We should all practice, physical and social distancing. We should actually isolate ourselves if you know that you are infectious so that we curb the spread of the virus. But we are equally working tirelessly, making sure that we know more about the virus.
Samukeliso Dube, thank you very much for your time this morning, the General Manager of the AfroCentric Group.